Local Health Department contract training, Payor Code 8 contracts. Payor Code 8 agreements should be between the local health department and a public or private entity. Payor Code 8 agreements should never be with an individual unless that individual is the public or private entity. Through Payor Code 8 agreements, local health departments have the ability to negotiate with public or private entities higher rates for services than rates that are listed on the 501 service file, with the following exceptions: KDPH, KDCBS, Hepatitis B agreement, Kentucky Fire Commission, and jail contracts involving incarcerated individuals. Negotiated rates should not be less than the DPH rate listed on the 501 service file in the Other field. Rates should cover the direct and indirect cost of the service. A HIPAA Business Associate Agreement, or BAA, shall accompany the initial Payor Code 8 agreement or an agreement initiated by a first party. Payor Code 8 agreements shall be completed on a fiscal year basis. After the initial BAA, another BAA need not be completed unless there are significant material changes. Changes from the 2013 HIPAA Omnibus Final Rule required language changes to business associate agreements. What does that mean? It means that all BAAs, whether previously existing or new, must contain the new language. The compliance date for this was September 23rd, 2013. More information and examples of business associates agreements can be found at the following web address. The Payor Code 8 agreement or other agreement shall be completed prior to providing services. Local health departments should assign and set up a contract code for each entity with whom they have a Payor Code 8 agreement. This would include other agreement formats initiated by a first party. Contract codes must be set up in both the bridge and portal systems. Contract code numbers should be entered into the CNCTC field on PEF entry, and P8 should be entered in the override field for each CPT code. Rates negotiated by the local health departments that are higher than the system assigned rates may be overridden without submitting a request to the Division of Administration and Financial Management for approval. A rate is required for services rendered, and an appropriate audit trail should be documented. Invoices shall not be set up at a zero value, nor should local health departments use nominal fee rates for services. Payor Code 8 contractors should be treated as third-party payers, and the exception would be they are charged at 100% of the cost, both direct and indirect, of the service. The Cabinet for Health and Family Services and DPH have agreed to the provision and payment of DCBS field staff for hepatitis B and flu vaccinations for designated First Aid Safety Team, or FAST, employees. Only those DCBS employees designated as FAST employees will be paid. Vaccine administration will be $22. However, the actual vaccine should be charged at the cost the local health department purchased the vaccine for. So the administration of the FAST vaccine shall be charged at $22. but you should charge at least what you paid for the vaccine. Overrides for making changes to the local health department cost of the Hep B or flu vaccine for this project is approved. If the rate of the Hep B vaccine is greater than $61, please contact Local Health Operations Branch at localhealth.helpdesk@ky.gov. DPH will provide quarterly payments to local health departments after validating services reported. DPH will bill Cabinet for Health and Family Services and DCBS annually. Local health departments will use Payor Code 8, Contract Code 701 for reporting these services. If not reported correctly, local health departments may not receive timely payments for services provided. Payor Code 8 contracts related to jails. Local health departments may contract with jails through Payor Code 8 contracts to provide services to incarcerated individuals. Kentucky Revised Statute 441 provides information regarding the responsibility of jails to provide access to and payment for necessary care for prisoners. The Kentucky Medicaid Physicians Fee Schedule rates shall be used on these contracts. Information at the website below. Contracts for services provided to jail employees shall be treated the same as contracts with other public or private entities. A sample CH-52 jail contract with languages for services provided to incarcerated individuals is available. Payor Code 8 contracts with the Kentucky Fire Commission. Local health departments are to use the CH-52 Fire Commission contracts when contracting to provide hepatitis B vaccinations to those firefighters approved for the service. DPH encourages all local health departments to contract with the Fire Commission for these hepatitis B services. Health departments are the only entity that the Fire Commission will reimburse for these services. Language in the contract should not be changed. Local health departments need to fill in their name and address and have local health department and Fire Commission authorized signatures. Contracts should be completed prior to providing the hepatitis B vaccination services. Local health departments will set up their own P8 contract code number. This needs to be done in both the CMS portal and bridge systems. Local health departments should submit the Fire Commission hepatitis B voucher along with their billing document to the Fire Commission. However, the local health department will not receive payment from the Fire Commission unless a valid contract is on file. Information at the website linked below. Vaccine administration rate is determined by the Local Health Operations Branch using the AMA Code Manager software and updated annually to the 501 service file. The vaccine itself should be charged at the cost the local health department purchased the vaccine. Overrides for making changes to the local health department cost of the Hep B vaccine for this project is approved. Payor Code 8 contracts will not be reviewed by DPH, but we would like for local health departments to save these contracts to the Payor Code 8 contracts folder on the L drive for referencing if applicable. For questions concerning Payor Code 8 contracts, hepatitis B or flu CHFS contracted services, contact localhealth.helpdesk@ky.gov or by phone at 502-564-6663. Option 1.